On behalf of the Board of Directors of the Stewards of Change Institute, it's my privilege this afternoon to welcome you to our closing and highlight of the entire symposium, a discussion and presentation on some approaches to many of the problems we've been dealing with by some very distinguished panelists. I had an honor about 2 years ago to participate in a very intense discussion with among and with a lot of nonprofit executives in the Washington area about what is the proper role of the federal government in social programs like justice and health and human services. And there was a lot of discussion on the part of practitioners and representatives of various associations and state and local players that, the first question you always ask federal representatives when they come and sit at the front of the room is, did you bring your checkbook? And it's always an unfair question, of course, because they never really do bring their checkbook. They always delegate that, but there's probably somebody in the room who's carrying their checkbooks, I'm sure. But, one of the things that we expect of federal agencies is to play a role in providing leadership to their respective fields. There's kind of a feeling on the part of a lot of people in Washington that innovation really occurs at the state and local level, and it's the job of federal agencies to find those innovative approaches and evidence of what practices prove to be useful, aggregate that information, evaluate it, and then participate in the dissemination and thereby provide thought leadership to all of us in the field. And we think that federal agencies are really in the best position to play that role, and they have that obligation and responsibility on their heads as a result of the enabling legislation that calls them into being. So we asked these three individuals to join us today in that capacity, and not here to talk about their budgets, not here to talk about the lack of money or the sequester, but to talk about how we can all learn and move forward in this learning environment we aim to create to better serve the citizens of America in health and human services. And so we're very pleased to have three very distinguished individuals. I know that you all know what George Sheldon does as the acting Assistant Secretary of the Administration for Children and Families. You've dealt with that organization for a long time, and it has an enormous, really worldwide responsibility for things like child welfare. And George has been very deeply engaged in that work for a long time. And I know that you have some general notion of what Jessica Kahn does as a senior technical advisor to the Data Systems Group. We've been talking, Jessica, about the fact that it is about the data, and it's the availability of that data which will lead us to the kind of analytical conclusions that will help form the future of this field. And that's been a subject of discussion here since we began this symposium, and I know that you'll speak to how we might capitalize on that momentum. And George, among other things, we've been discussing personas that represent what we believe are some of the typical cases and complexities that are provided to people that are providing health and human services, and looking at those personas in terms of how we can shape a more coordinated, collaborative future in health and human services, and bring these two fields more in line with what the citizens and patients and clients need in those respects. The person who's probably maybe a little new to you, and you may not know about this organization, is Kshemendra Paul. Kshemendra runs a relatively new organization that was created by Congress as a result of really going back to the 9/11 tragedy and the report that came out on how to deal with 9/11, the Congress created an organization that they parked in the Director of National Intelligence, but gave a nationwide, in fact worldwide, obligation to look at this whole issue of information sharing. And Kshemendra is called upon by Congress in the law and by executive order of the President to actually develop standards for creating an information sharing environment that encompasses federal, state, local, territorial, and tribal organizations in the U.S. and with our international partners. I know of no other organization in the federal government that has that kind of charter and has an obligation, as he has evidenced in many ways, to reach out to the state and local world across all of the missions of government. In the federal arena, his limits were established by Congress initially to focus on counterterrorism activities, but as he quickly learned and found out, that things you do to integrate sharing of information across government agencies for the purpose of counterterrorism happen to be very similar to the same things you need to do to integrate health and human services. That is to say, we need standards for interoperability. We need standards for data and vocabularies that allow us to speak across these domains. So Kshemendra works for the White House, and his mission was actually enlarged in the last year when, in addition to the information sharing role, he was asked to take on the safeguarding role. So if you want to know what really was behind the events of the NSA revelations last week, don't ask him because he can't tell you. But he is truly, from a policy perspective, now responsible for safeguarding and for things like cybersecurity. So his concerns are your concerns and are all of our concerns as we try to improve our ability and quality of information sharing and knowledge sharing in this complex world in which we live. So I won't go into their detailed vitas. They're all in your package. You can see the distinguished careers of all three of these individuals. So I'm going to, without further ado, ask them to tell you a little bit about what they're up to and provide their ideas on how we can all move forward collectively. And I've asked each of them to speak for 10 or 15 minutes, and then we're going to have an open dialogue, so get your questions ready, start writing them down as you listen to them speak. And just don't ask them where their checkbook is. So let's start right here with Kshemendra Paul.
Well, thank you and good afternoon. Thank you, Paul, for that kind introduction, and thank you to Stewards of Change and Johns Hopkins University for hosting this event. Let me give you just a little bit first on my background, then I'm going to talk a little bit about the mission of my office and some connection points with health and human service related activities, and then end with the National Strategy for Information Sharing and Safeguarding. So President Obama appointed me to this role about 3 years ago. Prior to this role, I was the federal chief architect within the Office of Management and Budget inside the Executive Office of the President. I was there for 4 budgets, 3 years, 2 administrations. Prior to that, I was at the Department of Justice working law enforcement and counterterrorism information sharing issues as the chief architect at the Department of Justice. Prior to that, I was in the private sector working all sorts of different enterprise IT related applications, a little bit of consumer technology in San Francisco and the Silicon Valley, and by training I'm an electrical engineer, graduate and undergraduate. I go through all that because even though I sit right now in the Office of the Director of National Intelligence, I really have a passion for information sharing and interoperability, and come at it as a trained professional and somebody that brings a national perspective based on the time I had at OMB and also the time I had in the private sector. So my office, the vision of our office is national security through responsible information sharing. We have a 3-part mission. The mission starts with advancing the counterterrorism, homeland security, information sharing mission, whole of government, as Paul talked about. The second part of our mission is advancing information interoperability by catalyzing a movement from information ownership models to information stewardship models, which kind of fits with Stewards of Change. I kind of like the name Stewards of Change, by the way. The third part of our mission is building capacity with our federal, state, local, tribal, private sector, and international partners. My office's role is a governance role, a leadership role, a standards and architecture, a policy role. We're not operational. That's organizations like ACF that actually own the mission, make the investments. It's you all at the state and local level that come together. Now, the roots of our mission in our office come out of the tragic events of 9/11. The 9/11 Commission report, a wonderful, really innovative statement of policy, if you look at it that way, laid out and called for an office like ours. The Markle Foundation had a series of seminal reports that I think are, as much as they were focused on homeland security, counterterrorism, I would still commend today as really very interesting policy innovations about whole of government approaches at the intersection of privacy policy, leading edge technology, and national security. Three attributes of the office and the law that kind of put us into place. Number one is a whole of government approach, right? It's no one agency, no one domain of activity can solve a problem like counterterrorism and homeland security. It takes a whole of government approach. We span across 5 communities: law enforcement, homeland security, intelligence, foreign affairs, and defense. Distributed and decentralized, right? We're not about building a big database in the sky or connecting or building a new approach. It's about interconnecting existing policy, business processes, networks, and databases. It's a real focus on interoperability, not just technical interoperability, but up the stack: business process interoperability, policy interoperability. And then finally, continuing to strengthen privacy, civil rights, and civil liberties. My mission includes safeguarding, that's information security, but also safeguarding the digital identity of U.S. persons represented in information that's entrusted to the government. Kind of a critical thing and something that really has paid dividends for us as, and I'll highlight a couple of key examples of initiatives that we've driven. One is the National Network of Fusion Centers, kind of a key linchpin to connecting 18,000 police departments in this country, 90% of which have 50 or fewer sworn officers, connecting them into a national architecture. Folks remarked in the aftermath of the recent Boston Marathon bombing how well things worked, in terms of the response, and a lot of that was very effective information sharing, federal, state, local, and side-to-side information sharing. The city of Boston, other jurisdictions across the state with neighboring states. There's obviously opportunities for improvement, but all in all, it worked pretty well. And President Obama noted it as such when he was talking about the events of Boston. He highlighted that as a big plus. I want to talk a little bit now about some of the health and human services related touch points, and I want to first preface this by saying it's out of my mission domain. The reason I'm involved at all with human services is because of a personal passion around best practices, sharing them, sourcing them, integrating them, because of a professional commitment to the field of information sharing and interoperability of information-led transformation, and because I have a component of my mission focused on best practices in sharing those for this information integration sort of view. So nobody worry about the Office of the Director of National Intelligence getting involved in human services activities nationally. That's not why I'm here. It's about best practices. Okay, so I have to tell you that from an information sharing perspective, my favorite information exchange is actually rooted in the Administration for Children and Family, something that ACF did jointly with the National Center for State Courts, looking at 360-degree intervention for at-risk youth, driven primarily by the need to enforce child support payments. Right, and what folks came to the conclusion of, and this is work that happened in the previous decade, that an at-risk youth will come into contact with the government, usually through a law enforcement sort of event. But a law enforcement intervention, that's not necessarily in society's best interest or the best interest of the individuals involved, especially the children. So wouldn't it be great if you could do effective 360-degree information sharing to get a holistic picture of what's going on, so you can effectively look at child welfare information, child support information, school information, court information in a trusted environment to be able to drive that proper sort of intervention. This was some work that happened in the previous decade, and it's growing now, but that's a great example of the use of the National Information Exchange model. The core framework, something that I've had personal involvement with going back to my time at the Department of Justice. The Administration for Children and Family is the domain steward for the Human Services domain. Really very, very great example of how to drive interoperability across different domains of activity, levels of government to be able to provide effective services to citizens. Another great example is something I learned about when I was jurying the Best of NEAM Awards. Even though I'm no longer directly involved with NEAM, I'm still kind of on the periphery, and they kind of pull me in every once in a while. And so I was on an award jury, and I'm reading this award application, and I was just blown away by it. It was from New York City's Health and Human Services Department, and they had used the NEAM in a very leading edge way to interconnect 32 federal grant-funded programs delivering human services to 4 million New Yorkers. And the problem sort of before was that each of those programs was administered separately. And what they wanted to do again was that integration of programs to provide that holistic view, to be able to better deliver services to citizens, not only more efficiently, but to drive better outcomes, collect better information. I remember reading in the New York Times about this. Now, I scooped the New York Times. We gave them the award in 2009. This was a New York Times article in 2011 where they talked about this application, and it was, they brought up the idea, what about privacy issues in terms of integration? And the folks in New York City, they were on message. This is great. They were saying, no, it's privacy by design. It's built in. We're protecting privacy and delivering effective services to citizens and doing it more efficiently. It was a wonderful, wonderful thing to be tangentially involved with. Kind of coming now to a more up-to-date, and this is, again, something that we're involved in from a best practices perspective. The biggest narcotics problem in this country is prescription drug diversion, prescription drug abuse. Two statistics blew my mind. 1 in 5 teenagers is going to experiment with prescription drugs, and only 20% of the prescriptions in the state of California are written for residents in the state of California. Right? There's a huge diversion, interstate kind of activity going on with prescription drugs. Big activity with the Office of the Drug Czar, the Office of the Director of National Drug Control Policy, SAMHSA and HHS, Department of Justice, to drive interoperability with prescription drug diversion. This is spanning between public safety and public health. And what folks did is agree on a common policy, a common business process, and translate that into technical standards that were actually implemented by health IT vendors and states based on a certification process, so that now the different states can actually buy products that support this information exchange out of the box versus the traditional model in the public sector, which is we pay through the nose after the fact to get changes to our IT systems. A big thing, and it actually points the way towards standards-based acquisition and being able to buy interoperable solutions for these broad-based, large-scale information sharing challenges. So quite excited about all three of those. I want to end to talk a little bit about the National Strategy for Information Sharing and Safeguarding. President Obama signed it out. You can find it on my website, www.ise.gov, National Strategy for Information Sharing and Safeguarding. It's a pretty big deal to talk about sharing and safeguarding in the same strategy. Right? 3 principles that were highlighted. Number 1, information is a national asset. What you're talking about there is the idea that information has value across its life cycle. We have to safeguard that information to safeguard the value of the asset, but it's an intangible asset. The value increases the more it's appropriately shared. Right? So that's a big idea. Usually what we do with IT systems is we build them for a transactional use, and then we worry about and spend more money after the fact about how to share information, as opposed to thinking about the information, the data, as the first-rank object, and thinking about its life cycle and how to safeguard that asset and how to maximize the value of that asset across its life cycle. So that's the first principle. Second principle is that we need to do shared safeguarding and sharing risk management. Right? It's 2 sides of the same coin, sharing and safeguarding. And as I said, safeguarding is information security, but it's also protecting the privacy rights of the information as it reflects our citizens. Third principle is what we used to call a tautology back in high school English. Right? The idea that it's obvious on its face, but actually has some power if you pull on it. The point of information sharing is to make better, more proactive decisions to protect the American people. right? So really what we want to be able to do is work backwards from decision requirements, right, as opposed to building policy around information based on classes of information and then trying to get around that or work and bridge that policy after the fact. The Markle Foundation called that an authorized use standard. Now, that's a big idea. We have decades of policy based on classes of information as opposed to classes of requirements. But it's an important concept, right? If you want to get somewhere, you need to start your journey with the end in mind, right? It's kind of a simple idea, but it's very powerful when you really think about the implications in terms of policy and how to drive that down into how we procure systems and how we think about interoperability. So, you know, the last thing I'll say is that it's just about the information, right? It really is information, and I applaud forums like this looking at identifying and using best practices from other domains. I think it's great that the human services space is, you know, looking at opportunities to leverage things like the National Information Exchange model that have, you know, that are very broad-based. And I'm, you know, actually very keen to pick up and learn from what you all are doing as we go back into the Homeland Security counterterrorism space. More information about anything I've talked about, you can find it on our website, www.ise.gov. Follow us on Twitter, @ShareAndProtect. Come to the website, sign up for email alerts. Thanks.
Thank you, Kshemendra. Secretary Sheldon?
Thank you. First of all, I appreciate you putting it in that context, because this really is about the delivery of services to people, making what we do in government more accessible. This is not about technology. In reality, technology is the easy part. It's really changing the culture of how people throughout government operate, and throughout the private sector as well. Because I think a lot of folks kind of recognize that information is power, and if I control the information, I control the outcomes. But what that's done is it's created a series of silos throughout our society, and information silos that follow that. And yet people out there who have real needs, whether it's that child support recipient, or whether it's a child in foster care, or whether it's someone with a mental illness, there's an array of governmental needs that they have and governmental benefits that come to them. And I think that's an important context to put this in. So while it's about technology and the use of technology to improve the way we deliver services, it also is, the most important part is changing the culture of how people think. I remember when I became Secretary of the Department of Children and Families in Florida, and we had like 400 lawyers in the department. I mean, the way to solve a problem is always throw 400 lawyers at it, and you will get there. But after a series of kind of obstructions, I basically called the leadership of lawyers in and said, you know, as a former Deputy Attorney General, a former Associate Dean of a law school, I can hire lawyers every day who will tell me why I can't do something. What I need are some lawyers who will tell me how to get to where we need to get. And I think that is an important component for leaders of human service systems around the country to begin to question. Because we have used HIPAA and FERPA and all of those elements as restrictions in terms of the sharing of information. We're hoping in the next couple months to be rolling out a confidentiality toolkit, which can be used by states to say, okay, what can I share? Who can I share it with? I think that can be a valuable tool. Currently, it's at our General Counsel's office for review. And it could be there months. But I would like to work with some prior to that to say, are we moving in the right direction? Is this the kind of thing that could be helpful to you? We were pleased to really develop the human services domain under NEAM. And you know, the other domains, obviously, it's Homeland Security, Justice, and I think this is an important step forward. We've rolled out in conjunction with Stewards early on and with John Hopkins a national human service architecture, which we are hoping that can be useful either all or in part with states as they proceed to develop a system which really allows for the sharing of information. Also, I think a lot of you know that Congress is currently looking at legislation which would require data standardization so that we begin to really talk in the same kind of language. I think that will give us a lot of additional guidance. But in the meantime, the opportunity under the Affordable Care Act with 87 waivers, where you have a state who's got first the political will and secondly the technical capability to really utilize the 90-10 money to design a system which is responsive to developing, getting their insurance exchanges up and running, Medicaid expansion up and running, can use that 90-10 money for human services components. That is a huge step forward for states who are willing to do that. And I think close to 40, if not more by now, of the states have submitted APDs to CMS to begin to draw that money down. Some are looking in a much broader sense than others. Obviously, some states are looking at things as basic as uniform eligibility determination and sharing of eligibility systems. I'm hoping that states will begin to look at how do we integrate our SACWA system into that human services domain. We've rolled out I believe 7 interoperability grants to 7 states around the country to really look at things like governance, communications, unified interfaces, tools to message and track client outcomes, data sharing services. And a couple of those I've seen are here, maybe others, California, Colorado, Oklahoma, Illinois. I talked to Indiana, New York, Maryland. So where we at the Administration for Children and Families are kind of standing up these tools for folks to use, it really is incumbent on states to take what's good in those tools and work with us to try to improve them. One thing, and I've only been in the federal government for 2 years, so but I discovered very early on that all knowledge doesn't reside in Tallahassee. I mean, in Washington. So I think that we can learn from you as we do that and as we move forward. I'm looking forward to the results of these 7 interoperability grants that we've rolled out. And between now and I think they are to submit the outcomes of those by the end of this fiscal year. So I'm hoping that after that we can look at some of what's happened in those individual states and really use that as an opportunity to roll it out to other states so other states can begin to experiment. I really do believe that states are the laboratories of innovation and that we can provide some basic guidelines, some basic structures, some basic tools like the confidentiality toolkit. We can provide some funding to move forward. But I think the interest of the National Security Council, the interest of the White House in really helping to coordinate and recognizing that as a nation, the human needs, the health needs of people are as real as their security needs. I have said many times that we in the Administration for Children and Families really deal with vulnerable children and families. I'm convinced that there are really only 2 things that keep people vulnerable. It's access to health care and it's access to education. 2 systems that have been siloed, separate and apart from human services. I was pleased to see that Congress just last year recognized that there needed to be changes in FERPA. And they recognized that if you have a child in the foster care system and under the Fostering Connection Acts, states are to monitor and report on the education outcomes of children in the foster care system. But under FERPA, we're denied in sharing information with the education system to find out, in fact, what those outcomes were. I think Congress recognized that, and now There's an exemption from FERPA to allow education to share information with child welfare. Those are the kinds of things that we need to look at, and not just have confidentiality for the sake of confidentiality. Who needs to know, and what do they need to know in order to move a system forward? Those are the kinds of questions I think we're going to be grappling with. I want to see as a facilitator with you, and that's the reason we have our general counsel's office involved, and they are committed to taking a realistic look at this to see if there's a mechanism by which we can assist states to really give some guidance as we move forward in trying to really develop an interoperable system.
Thank you, Mr. Sheldon. And Jessica, tell us about the data.
So much happening at CMS these days, right? Hi, everyone. Oh, that was very interesting. I was trying to think like sort of where to start, but I feel like I'm in another alternate universe that is uniquely focused on 111 days, including weekends from now. So my long-term vision has gotten really short lately. So maybe I'll start a little bit with our as-is, and then I'll show you where we are and what's quickly on the horizon. So information sharing, cover what you know. Medicaid and CHIP, we've been doing that. Not as easy as just saying we've been doing that. There are a number of states that have separate Medicaid and CHIP agencies, and 9 that currently have separate Medicaid and CHIP eligibility systems, including some of the largest, most populous states. So bringing that together and sharing back and forth, big task. Then there's Medicare and Medicaid dual eligibles and data sharing around that to support care coordination and a number of other tasks. We've made a lot of progress in the past few years with states who've been asking for that data on the care that's been received on both sides, and have done some demonstrations there out of our duals office. And we've obviously been on this journey around integration with human services and Medicaid and CHIP also for a while. And that's still, of course, ongoing. I think the A87 waiver clearly and the 90-10 funding is going to leapfrog it at a much faster path than it has been. But then here's this whole new insurance exchange and all these other people who are above a certain % of poverty and are going to get eligibility under the insurance marketplaces. And now we have to move their data. And guess what? They're often in families with people who are covered by CHIP and Medicaid, and they need human services in many cases because it's still not a given that they're in, because they make too much for Medicaid and CHIP, they're therefore ineligible for the variety of programs that states' human services agencies offer. So this is now an information sharing issue on steroids. But I don't think it's a Sisyphean effort. So this is kind of where we are. I mean, obviously our goal is not just to put an insurance card in people's pocket, not just to get them coverage, not just to get them enrolled in human services or in Medicaid or in CHIP or in an exchange. That's an output, not an outcome. Our goal is to actually improve their health care and improve the population health, therefore, and bend the cost curve in an appropriate way. So while our efforts in 111 days are really around open enrollment to open that door and allow people to have that first step in, there's a lot that has to be in place for that to happen. So what we've been focused on is a huge effort around data sharing between federal agencies, which has been both fruitful and challenging. And since we're all amongst friends, I feel like it's important to be transparent about what those challenges and the fruit that has been born are. So on the fruitful side, states currently get data on eligibility for Medicaid and CHIP to verify that eligibility from a number of different sources. And starting on October 1st, they'll be able to get at least the Social Security, Homeland Security, IRS, work number, which is a commercial source of current income, and for existing coverage from up to 9 other federal agencies. They'll all be able to get it through the Data Services Hub for Medicaid and CHIP and the insurance exchanges. The challenge is, somebody say it, who isn't getting that data from the hub? Come on, Wade, you know when you want to say it. Anyone else? Huh? Human services, right? So, talk about We can have harmonized data sets, we can have same data standards, but our data use agreements don't allow us to do the one thing that we just built a technology solution to do. Share it. And it's the same data for the same people that they're currently getting under data use agreements that read nearly exactly the same with the same agencies. Just saying, there's some people at this table slightly higher pay grade than myself. This is on my parking lot for after 111 days from now. Everyone will be hearing from me. That's a problem. We've got the technology. We have moved the mountain of multiple federal agencies and their disparate systems and how they want to do things, and can we all just get on the same page for web services and all the service level agreements about what happens when this one goes out and this one goes down and the hub's not storing information, and we've even gotten to a pretty good place on regulatory conflicts, though there's some work there to go. But we need the data use agreements to follow the vision that you're hearing, that we have, that we share. And that's that as somebody comes in and is looking for care, that they're looking for care that actually improves their health, and that could be food, that could be other kinds of supports. It doesn't necessarily have to be just insurance coverage. And so that's really important, because that's what really, for me, that's what we're talking about, is the seamlessness at the consumer side. I don't care how messy it is behind the wall. It could be really messy behind the wall, but if the consumer doesn't see that, if a family can come in and apply and end up in 3 different insurance buckets, and they applied once, and they entered that information once, and it got sent to who knows where, I don't care, but as long as for them it was seamless, for them they had a response back, and it addressed them as a family, and when they have to do updates, they can put them in as a family. They know where to come back as a family. Then that's progress. And that's not necessarily going to be the reality on October 1st for all states. I think it's it varies by where the state is at, and some of them are going to get there sooner than others, but it's still very encouraging to me. Another barrier that I think we have come up across that we knew about, but is turning out to be a little bit harder than we anticipated in attacking, and is again on the after October, I should say now, I should call it my October 2nd parking lot, haha, is redundant technology. Like we're just so good at technology that we just replicate it. Same thing 56 times, woohoo, we're so good at that, let's just do it over and over again. Well, that's a barrier to innovation, because our checkbooks are finite. And our time is finite, and your resources are finite. And just because it's the best web service in the world doesn't mean we have to build it 56 times. Maybe we can build it in a way that it could be shared as a technology on a technology platform. And this isn't just the behind-the-scenes stuff. We see this on the ground with providers telling them, you don't want to submit quality measures to 10 different places. This one wants it on this 6 months. This one wants it on that 12 months. This one wants it on all your patients. This one wants it on just Medicaid. They want the seamlessness at the provider level. The consumer wants it at the insurance or the human services level. We're trying to do it on the eligibility data level. So there are lots of places where we'd like to be able to move the incentive to match the vision. So the incentive right now is to build it 56 times. In fact, when we say reuse it, we, in essence, are, again, incentivizing that behavior, because we don't mean most people think we mean, that was the great idea, I'm giving it to you, and now you can go replicate it in your state. But I'm talking about real reuse, which is, that's a great idea, you can come and actually share my platform that I built in my state, which is totally different, and that means we have to have funding hooks and funding incentives for that behavior. Because ultimately, where these worlds are all going to collide, I hope, and for Zach, Jiwa, and Ivan, and anybody else who heard this at HIMSS, feel free to check your mail right now. My vision for where HIX and HIE are going to overlap is that when I come in to look for insurance coverage with my proper consent, the data is there to say, Jess, you have your kids all go to this pediatrician, they know from my integrated profile with my claims data. These 4 plans that you're choosing from, your pediatrician's actually only in 2 of those. And you seem to be on a number of medications that are available and would be cheaper for you on the 90-day supply. These plans only offer the month-to-month, not the 90-day. And you go to urgent care a lot, you need to be on one that has a lower copay. So I'm making an informed choice because the idea, again, is not just to get a card in my pocket, but to get me in the kind of care that supports my family better, supports my costs better, and aligns my priorities around my health care. And that can only happen if all of this data comes together in a protected way with the right kinds of consent and in a timely way. And while I'm at it and consenting for this so that I can make a better healthcare choice, it should tell me, these are the providers that use electronic health records. These are the providers that participate in health information exchange. This is where you can go to consent to be a part of health information exchange and pull it all together. So now I'm not just a covered life, now I'm an informed covered life in the healthcare system. And at some point, someone's going to want to know if I'm healthier as a result of all of this. I imagine our friends in Congress are going to ask that question. Though, you know, I said that really glibly at HIMSS, actually, and somebody came up afterwards and said he worked in the, what's the office that does all the reports for Congress? No, not the GA. CRS. And I was like, dang it, I just did that to myself. He's like, that's a great idea. I was like, no, I did not just do that to myself. CRS, thank you. Because they're going to want to know, am I still going to the ER inappropriately like I did when I was uninsured, now that I'm insured? And if I'm not taking my medications and if I'm not in a stable care coordination issue, maybe it's because I don't have secure housing. Maybe it could be all these other issues that are happening, like really thinking about the social determinants of health. And where are you guys going to get that data? Do you want that data from us? Because that's another conversation we're having at CMS, is how to create a Kaiser-like data platform so that you can come on to Medicaid.gov and see how many people have been enrolled and in what groups, and know whether that's an expansion state or not, whether it's a state-based marketplace or not, and how they addressed any number of choices that they still have within the ACA, and how they're aligning their system and what kinds of targeted enrollments they're doing. For example, we just did a letter to all of the states talking about people who are in SNAP are very likely, according to recent reports, to also be eligible for Medicaid high, like in the 90s. So if they're already there, is there a way to pull them into Medicaid so you don't have to make them go through the whole enrollment process all over again? Like, what do we already know in the system, people? And that we can share to make that easier so that you don't have a whole huge group of people all crashing your system, which is brand new, all at the same time. So which states are doing that and taking advantage of those kinds of methodologies? That's all really great administrative data, enrollment data. Everybody's going to be asking us for that, states for that. Our colleagues are going to want to know that. We're also rehauling our MSIS, now called Transformed MSIS, TMSIS platform, so that we can provide data not just to our internal stakeholders, but again as a platform for research for states also on what kinds of services are being claimed, and not from 2009. Like, you don't want to know what were the top 20 diagnosis codes in 2009. Unless you're, like, you know, doing your 5th grade research report. But for all the rest of us, that's a little old. We want to know what were the top claims for what were the major issues that were driving the costs and the morbidity in these populations in a timely way. So we're hoping with these kinds of changes that we can get our hands on that data in a like-to-like, apples-to-apples way and make it available to the world as well. So we need to think about how to do that. Other tools that we have at our disposal that we're working on are, if states want to come in, for example, and do interest in care delivery reforms, then we're going to say in our terms and conditions and in our negotiations for those care delivery reforms, so what's your data sharing infrastructure like? What's your health information exchange investment like? How are you making sure that the pathways are there for the data to move, for you to reach those care coordination goals, for you to actually end up with that transformed healthcare delivery system? It's not a given, and you know, we have a lot of policy wonks over here, and then you have a lot of like system IT people over here, and never the twain shall meet. So we need to pull them together and say, you guys actually have to talk, because you got to build that runway while you're flying the plane, which I just had to say in deference to Rick Freeman, who's not here, but you know that's a Rickism. I had to throw in at least, huh? He's in Alaska. That's fair, right? That's fair. He's not here if he's in Alaska, but. Anyway, so my goal in telling you all this is because it's not just about marching to the drum of who's asking for data, but making sure that we have the data to do the decision-making and the analysis and the care coordination and the less sexy things like fraud and abuse, and of course security and those issues at our disposal. And we have a lot of tools to get there, but we're also very focused on what the consumer sees on the outside. And if we can do those on a parallel path, I think we'll have achieved a lot, since usually one tends to bump the other. Okay. So I think I'll stop there.
Thank you all for your comments. I have several embarrassing questions in mind for these panelists, but I'm going to let you have the first call on it. So, Ivan?
Very, very impressive. I have a couple of questions for Jess, of course, and one of the things, aside from how do we deal with match, that's an obvious question. One of the things we're thinking about in Illinois, and I'm wondering if it could happen here, is a lot of the questions you've asked for, a lot of the things consumers would want and even states would want are complex to build. The procurement cycles will kill us. Can we do something to set the right criteria up so the private sector can come in and sell these solutions, at least to the insurance companies and others, and see how well they do. Because if we get out of the way, provide the infrastructure, the standards, some kind of certification and evaluation, we got to do something. But if we don't have to build it, specify it in detail, and let other people come in who can do it quickly, I think we'll have a more effective system and much happier, people who are going to use this system, as opposed to if we try to do all this stuff by October 1 or whenever it is. I just think we'll have a lot more egg on our face than if we can let the private sector in.
Right, I mean, I agree, not every office needs its own version of Excel, right? Like there's, in some sense, there's a goal we're trying to achieve, and the private sector is following the direction and the money that's being dangled, and why wouldn't they? That makes a lot of sense. But if the direction is figure out a way to identify the key common processes and business functions across all of these systems and have it in a way that protects the security but also allows for multi-tenant use, and our funding 90/10 incentives align for that, so that states that are beholden to their legislative budget cycle of this year, not the total cost that's going to show up in 5 years or 6 years, then maybe we can work on that and realign that. It's not an easy task, but that's one that we have our eye on, not just for this, but for MMIS and for a lot of other Medicaid IT.
I happen to know thatKshemendra's office is taking an active role in dealing with this very issue of procurement. Kshemendra?
Yes, I talked earlier about standards-based acquisition, and it's great that Jessica's right that the work that they're doing with MMIS, with NASIO, around the START initiative and things like that. Wonderful stuff, wonderful stuff. Let me give you an example of something we've done that we're using as a proof point and trying to scale up now in the national security, public safety, homeland security space. The FBI has a system called NDEX, National Data Exchange. It's hosted out of their CJIS division in West Virginia, Criminal Justice Information Services Division. It's really a crown jewel in federal IT. 18,000 police departments are trying to share law enforcement information. All the authorities are there. They've been doing this stuff for a long time, but they're trying to get lower level police information into this so they can better connect the dots, just from a traditional law enforcement perspective. The cost estimates done by the IJIS Institute, an industry organization in the justice, public safety, homeland security space, were around $250,000 to connect legacy record management systems, that's the police case record systems, into NDEX. By using NEAM, National Information Exchange Model, Information Exchange Package descriptions, and some other technicals to interoperability standards package, that cost went from $250,000 to under $10,000, 25 to 1 cost savings. It's been key, and we're actually now looking at the next generation where most of the big and mid-sized departments are already connected. Out of the 18,000 police departments, something in the order of 6,000 to 8,000 are connected. That last mile issue, the really smaller guys, what we're looking at now is partnering with the Department of Justice to do micro grants that are aimed at industry, right? Because right now, the cost of sales to do a custom implementation takes that $10,000 cost and raises it up to $40,000 or $50,000. whereas they're all doing the same mappings, right? So if they can just do it once, right, then it becomes easy to provide in the next product upgrade cycle to these smaller guys to get that last mile in. So we're working with the General Services Administration, with the grant-making community to look at the next generation of standards-based procurement to do exactly what you're saying. The idea being, it doesn't work for everything, but when you have discrete exchanges that are broad-based, right? Maybe it's eligibility determinations, right, or court filings, or the encounter type information that I talked about earlier. When it's across thousands of stakeholders, state and local stakeholders, right, then it makes sense to engage in that overhead, and there's a little bit of overhead of standardizing the business process, harmonizing the policy, expressing it in formal technical standards, working with industry through standards development organizations, like we did with the prescription drug interface I talked about earlier, to get the vendors to buy into the implementation, and then you use, model RFP language and things like that. In the justice and public safety space, there's probably several $1 billion. It's not quite as much as human services or health in particular, but it's material money, several $1 billion in justice, public safety, homeland security grants, and all of those have these special conditions on them. They're getting increasingly strict, right, and moving towards industry certification of conformance with the interface standards. So that's, kind of, I think, a lesson and an opportunity for the human services is to leverage what we've done, what they've done with the prescription drug, the PIMIX, the prescription drug diversion exchange, and go more broad, things like that.
And actually, there are at least 3 major industry associations now with task forces dealing exactly with this procurement issue. Some very high-powered people from both government and industry. The IGES Institute has a procurement task force, but ACT, IAC, and several other organizations who are active in the health and human services world, as well as the justice world, are collaborating now. And Tech America is another one to try to come up with ways to do this, because we still buy IT the same way we buy roads. It hasn't changed in 50 years, and the impediments to successful implementation are rooted in the procurement processes that are just totally inadequate. Yes, sir.
The group here has heard me talk about IT is what you can do and informatics is what you should do. And I'm thinking about your parking lot issues and whether you're recruiting academics to deal with the questions that you don't have time to deal with now. But you're all dealing with a lot of really heavy issues, and I don't know if academia is being recruited to help you with that. That was a question.
Anybody want to take that?
Not off the top of my head at the CMS level. There are a lot of stakeholder organizations that we work with, the Medicaid directors and many others. But I know that at the state level, there's a lot of engagement with academic organizations that I hear about and see. And that's different, though, than what I think you're asking about in terms of being places to help us mull over and think over those things.
It's always been a little bit of a pet peeve of mine that we don't do a better job in the federal government tying the R&D spend with the IT spend, especially R&D around information technology. It's hard, though. Everybody's got a lot of things to do, and it's one of these things that you never quite get to in terms of tying things better together. I will say also in the IT area, I think that the real opportunities for innovation are more on the collaboration, how we work together organizationally. I mean, the conversation that Jessica was just talking about, where all these information sharing agreements with slight variations, right, that aren't really advancing the mission and are all due to local decisions that in the moment were fine, but add up to this kind of bad situation. That's a human engineering issue, right? And so that's less about IT R&D. It's a little bit more about organizational, dynamics, and so I think there is an opportunity to provide more academic thought on that sort of thing.
There is. I will tell you, there's a considerable interest on the part of the National Research Council, National Academies of Science, and providing academic input to a number of federal agencies. I happen to serve on one of the committees of the National Academy, and there are some very exciting research projects going on and looking, for example, at big data and how to apply the analytics from big data in fields of cognitive behavior and things that are very relevant to social services. And they're very active committees, and they're being funded in some cases by grants from the R&D organizations in the federal government. Anybody else? Jessica?
Is there any long-term thought to changing some of the rules of the road at the federal level on cost allocation? As you talk about interoperability across multiple programs, there's a real cottage industry out there in terms of cost allocation, and it's turning into a bigger thing. I mean, everybody matches at some level. Many of those levels are about the same. Is there any way to kind of wash that out and just make it a little bit easier for everyone?
Yeah, so I'm not at OMB anymore, and a lot of those, I think Circular A86 is the one that talks about this sort of thing. What I will say, just I'll reflect on my when I was in OMB and we were doing Recovery Act implementation, and this came front and center, right, where there was a desire to do some shared services around transparency. It's challenging because you've got the countervailing thing where if you start to tax, right, to create a central fund, it loses oversight, and your less dollars are getting out. So there really is a legitimate reason why that's not allowed. I will say this push on special condition language, right? One of the strategies we're pursuing, and it'll take time to pay off, but one of the strategies we're pursuing is that, well, if the special condition language is consistent across multiple grant streams, right, then you can pool the money virtually at the other end, right, through procurement approaches. It's not about kind of taxing it and then putting it into a revolving fund. It's about maybe the fact that you're creating a bigger market across the multiple grant streams for the same kinds of interoperability solutions, right? And so that's a little bit of an indirect answer. It's a longer term answer, but that's sort of the approach that we're taking on to try to address that issue.
Hi, I'm Mary Ellen Wiggins, and I actually do work at the Office of Management and Budget. And I can't answer your question directly about cost allocation, but there is something kind of related from a programmatic perspective that I would like to mention that I think does show how the federal government is looking forward to this idea of thinking about the outcomes that we're getting for our money and how to give people the right level of flexibility to use resources wisely when they're so limited while maintaining accountability for what we're getting on the other end. And that's an initiative. It's actually before Congress right now in the president's budget. It's called performance partnerships. And these performance partnerships would be around disconnected youth, so young people ages 14 to 24 who are in trouble or at risk of becoming in trouble. And the idea is that, as you all know very well, at the state and local level, you're trying to serve vulnerable people who are touched by many, many programs. And it can get very difficult to do when much of your time or much of your resources might be spent not totally efficiently trying to comply with the various program requirements or do different kinds of reporting. And so the idea here is that state and local governments could come forward to federal agencies together and say, here's what we would like to do. We would like to work with the specific population of disconnected youth. Here are the outcomes that we would like to achieve for them. And here are the different funding streams that we would like to pool together. And in exchange for flexibility around how we would normally have to report on those different funding streams, we'd like to instead report to you federal agencies on just what we're getting overall for this population so that we can use this data that we're now better able to access and share to really inform what we're doing on the ground. So again, that doesn't really speak to cost allocation specifically, but I think that it does go a long way to talk about how we are interested in focusing really on outcomes and in making sure that people can use discretion in putting money where resources really should be best used while maintaining the right level of accountability.
Thank you.
Can I add to that? I am less optimistic that the solution is going to be in finding a way to blend the federal pots of money minus the cost allocation as opposed to what happens on the receiving side and us helping you blend them in a more effective way. And the reason that I see that is because each of them comes with its own strings and constraints about how we can use it, what it's allowed to be used for, and for how long, and what's considered development over here, and maintenance and operations is this over here, and this one is a grant, and this one is matching funds, and this one is a cooperative agreement, and it's just a big mess. So what we've tried to do in Medicaid IT, and we've been able to do this with several states so far, is just say, tell me what it is you want to achieve, and then let's let you write one advanced planning document that could cover all the funding streams we have available to us, and we'll help you do like a jumbo and put that together. It still reflects grant funds often that they get from other places, but instead of saying, here you just have to ask for eligibility money, here you ask for MMIS money, here you ask for HIT money, when really you're trying to build something at an enterprise level that could support all of those, we're at least trying to say, tell us the vision, and then we'll help you figure out the most appropriate buckets that we have so that we can best enable your process. And the next step to go beyond that, if we wanted to get really to challenge ourselves, which is, I think, feasible, would be to sit down with our other federal partners and say, this enterprise isn't just a Medicaid enterprise. This enterprise is also a human services and Medicaid enterprise and an exchange or a marketplace enterprise. And so we need to figure out how to do that collectively together. Will we get to one document? I don't know, but we could get to a lot of cutting and pasting of the same information, and we can at least get on the same page with terms and conditions and the vision and the reporting and those kinds of things, which I think go a long way at least.
Yes.
Thanks for your comments. This has been really informative and, frankly, affirming and refreshing to hear this level of conversation. I represent a rural community, and so I'm kind of curious where y'all are working with the FCC or the USDA to get information. We've had a lot of conversations about wanting to put instant information in people's hands, whether they're physicians, caseworkers, the consumer, and there are a lot of pockets in this country that don't have access to that information on a weekly, much less a real-time basis. And so I'm wondering if anyone would comment on that.
And that remains an issue. We spend a lot of time focusing on real time in the online environment as if it's ubiquitous and as if it's everybody's preferred path. But in reality, a lot of people like to walk into some place and get their care that way, because at least they know that they're going to leave, they hope, however long it takes, with some sort of result. So I think it's a dual process. Paper's not going to go away. We're going to still try to get the information to the providers who have access. And providers, I mean everyone from whether they're doing clinical or eligibility or whatever it is that they're doing, try to get it there and to enable it. But I agree that we don't want to overthink that it's all happening in the online environment without the continued effort to expand broadband and to reach those other places.
Physicians that can't participate in health information exchange because they just simply don't have access to the technology to make it happen.
Yeah, that's what we continue to hear.
Go ahead, Kshemendra.
Just briefly, it's not quite in the human services or health domain, but I did want to highlight something we're doing in the public safety area. And it's statewide information sharing environments. My role is to build a national information sharing environment in a distributed way, and several states are looking at what we're doing, and the national standards we're driving, things like the global reference architecture, the NEAM we've talked about, and saying how do they knit together the various small departments. New Jersey is a test bed for us, 479 police departments, where we're trying to connect those, and the colonel of the state police there, his vision is making sure that everybody, including the folks in the smaller departments, can effectively work in a statewide architecture, whether it's a law enforcement kind of issue, a counterterrorism, homeland security issue, or a public safety issue like and a recent thing with Sandy in that area. So we think that's a hugely effective model because it implies shared services, a public safety cloud-like approach, consistent policy. He's partnered with the state chief information officer, the Homeland Security advisor, the Attorney General in the state of New Jersey. Several other states are doing things like this. South Dakota, which has got a pretty strong, large rural population, has something called South Dakota Connect, ties together the entire public safety community, their law enforcement community. Illinois is actually very interested in doing something like this. Texas actually is a leading practitioner.
So are you the one that brings them all
From a public safety perspective, public safety, so the law enforcement community. But what we found is traditionally the different communities at the state level have been fragmented, right? We're stovepiped at the federal level. It's worse at the state level, in part because of how grant money flows. And one of the strongest points of contention historically has been the state CIOs and the public safety, police, CIOs not wanting to work together, right? And we're bridging that. And that's kind of, and I guess I'm highlighting this as an example of where in your states, there may be some new thinking with the CIOs, with the CIOs in each of the other functional domains, where there may be opportunities to look at common approaches for interoperability.
I know that the state CIO organization, Doug Robinson was here earlier, but he had to leave, but they've articulated broadband as a really strong requirement and high up on their list, and there have been discussions with the White House about making that a much higher priority, and part of the reason is healthcare. Shell.
Yes, thanks, Paul. Certainly appreciate all the comments and the help and your commitment toward interoperability, and certainly on the ACF and CMS sides appreciate the incentives. I think they're working. I think that we've gotten the ball farther down the field than we have ever gotten it. And but one of the things that we've been talking about at this venue over the last couple of days is the sustainability of the effort, because there's an overarching sense that this is a long-term kind of an effort. So I'm interested in your thoughts on sustainability of the effort and what you see as maybe coming up in the future to help with that, or how you are approaching that.
Right, the 90-10 funding is available through 2015, obviously, but the 75-25 is available now for states that have systems that are compliant with their 7 standards and conditions by that time, and to some extent sooner as they go live. So that doesn't, that's not very long in design terms, 2015. On the HIE and HIT side, our high-tech 90-10 funding is available through 2022, probably. I mean, the incentives are through 2021, but then they have to be paid in 2022 for what happened in 2021, and then you have to do auditing and so forth. So there's still quite a bit of runway left on the health IT side from the Medicaid contribution, and MMIS, it is what it is. There's not a sunset date. So that's a lot of pressure to get this integration done by 2015 in terms of the waiver and in terms of the modernized eligibility system. And I have no tea leaves to read about whether there's going to be any respite there, but I think it forces that smarter approach. I think it's the model that Ivan is describing as cheaper in the long term, and I think that it's going to behoove us to move that way, or we're going to run out of money. If we have to just keep building the skyscraper over and over and over again redundantly, we're going to run out of money. Not we, but collectively with the match.
And let me just add to that. One thing that makes that time frame even more difficult, CMS has been a real partner in this human services interface, but Medicaid agencies and insurance exchanges are out there facing these deadlines. And I know that a lot of human service agencies had difficulty getting the attention of their Medicaid agencies, which is the reason, to a large extent, governor's offices have to be committed to making these kinds of things happen, or otherwise I think states are at a disadvantage. I look at the number of states who are up there at the top, and it really, in terms of really getting their act together, and it really is a relatively limited number outside of the insurance exchange and the Medicaid piece.
Right, I mean, with the focus being on health first to get to October 1st and January 1st, that has meant that a lot of states have had to say January 1 is when we start doing our requirements and development for the human services piece. Not all of them. Some of them have migrated concurrently at the hip, and some of them have taken baby steps towards it. So it all depends on what the relative risk is to get to October 1 and January 1st with some grace. So, for example, I know of a state that's not going to be bringing on the human services piece until starting their build in 2014, but while they were populating their new rules engine, they just moved everything in all at once. So maybe at least that was just an incremental piece that they were able to do at that step. So it's not like an all or nothing, but that's really, I agree, has added to the pressure on the timeline, because it's not like the human service integration necessarily had the same length of project span as the Medicaid and CHIP side.
Well, I think we're going to need to draw this to a conclusion, but I have a final question.
Oh, and I have one too.
Huh?
And I have one too.
Okay. You want to go first?
Let me go first. It's my party, so I can ask a question, right?
Yeah.
First of all, I want to thank you all for coming. It's a great event, and I know we were all looking forward to it. So we had Brian Civic here on Monday and got us all riled up about the exciting things going on at revamping the Hubert Humphrey Center. We're expecting like romper rooms and all sorts of great stuff to really generate the creativity there and bring new people into the government and thinking about that. And more seriously, although he really communicated a lot of exciting things, which I think I certainly got excited about and others did, in terms of how do you reframe what's going on and all the excitement and all the new opportunities. And he talked a little bit about the Datapalooza and the 2,000 people and the hundreds of apps that are coming out of there. And of course, our attention said, well, what about human services? Can we join the party next year? Can we do something to free whatever data there is to be freed that we can look at generating that kind of interest? In and of itself, that would be exciting, it would be wonderful, and it would stimulate people thinking about a huge set of problems that could be maybe solved at the very local level, particularly even the rural level, and linking people and services quickly and rapidly, because we know how difficult procurement is. I'm going to get to my question in a second. However, we know how difficult that can be. Given the time frames, given the 2015 time frame and how short that time is, we know some of the Stewards folks have been involved with ACF trying to move that conversation, and certainly we made some good progress, but certainly the Affordable Care Act is job number one, and we're looking at October 2nd as well in terms of how to move that whole conversation forward. But being originally a marketing guy, it seems to me that we have a choice and an opportunity to take advantage of this lifetime opportunity by focusing and concentrating. There are 1,000 flowers that are blooming, but that's not helpful to drive that message at the legislature or within the human services communities or within the tech community to really realize there is an opportunity. It's a short time window now. We can take advantage of it. So the question is, can we do something to focus the attention on a couple of places or some really high potential opportunities to focus the country on that this is possible and that there's an incentive and there's a desire and a passion to tie into the human services, which I've heard all of you guys talk about in the past. And can we do something around a competition? Can we go back to California and Silicon Valley and put out some money and ask people to do it, focus the attention in a couple places, and see if we can drive attention and interest November 1st and get this thing moving so we can take advantage of the money, because who knows if it's going to be extended, right? Or if the A87 is going to be extended. I don't think we can operate on those assumptions there. And really to coordinate efforts in a way that can really drive it forward, because you've got 13 states in the room here that are dying to do something, and they're all trying to recreate it themselves, and that really ought not be the approach that we got, especially with the time limitations and the resource constraints.
Yeah, I'd love to see some brainstorming on what would be those targeted approaches. When I talk to states who are trying to undertake HIE, the other exchange, and they don't have the ability to do everything, what I usually say to them is, who's the most sensitive to improvement as a result of having health information exchange and better care coordination? So if you come back and you say, I had this amount of money and I only was able to take care, hook in these providers who see these 35,000 beneficiaries, but by the way, these 35,000 represent this much of the cost and the morbidity in our population, then that's amazing. So I'd love to see what conversation we would have about where to focus something like that, where in the human services and healthcare sphere overlap is there the most sensitivity to change and improvement, because that's the proof of concept, right? As opposed to, I agree with you, rather leaving it wide open.
Yeah, and I think the Datapalooza really has gotten everybody's attention and are kind of excited about what this is. And ACF, we actually have several databases that are now included in that, and we can get an enumeration of those to you, because I think there's a lot of data that we have, and I think we're finding out on the health side, there's a hell of a lot of data that the health side has. So let me get you what we've already done.
This is outside my domain, but the thing I would suggest to folks is that with a increasing level of sophistication and integration of service delivery, there's also an increasing obligation on the safeguarding side. So I would suggest that folks think about, safeguarding-oriented scenarios. For example, more sophisticated approaches to benefit fraud that may be introduced as these services are rolling out, right, and to try to get in front of that, or at least stay neck and neck with it. It would be an important thing to think about as you brainstorm.
Okay, one final question for each of you. Each of you have come here with a message that's very much appreciated. You echo what has been the conclusion of this conference, symposium, that it's an imperative facing all of us to find better ways to integrate health and human services at the information system level. Sitting before you are stewards of change from states, major counties, tribes, who are going to go home from this meeting wondering where should they spend their energy, where should they put, what priorities should they tackle now in the next 6 months to help improve this move to the interoperability between health and human services. What advice would each of you give them?
Eat your Wheaties. Okay, on a more serious note, and you heard me say this earlier, I think that there really is an opportunity to take a more broad-based approach. So I encourage each of you at the state level, at the county level, at the municipal level, to reach out to your state CIO, the county CIO, the public safety community folks that are working similar best practices and frameworks, like use of the National Information Exchange Model, like use of the Global Reference Architecture, which is very much aligned with and reminiscent of the MIDA and I'm sure the architecture that ACF has put out, because they're all leveraging the same body of knowledge. A lot of times when you do those sort of things, it becomes dilutive because you can't take that next step. But you might find now that you actually it could become accretive, and you could take a next step that spans across domains in a way that traditionally you wouldn't have been able to. So I would encourage you to think expansively when you go back and tap into those other domains.
I really would go back to where I started, because I think one of the things that we've failed to recognize is that this is more than technology. And I think one of the things that each of your systems, whether it's a state or local system, you've got to focus on is also the culture within your system, to really get people, before you can get databases to talk to each other, you have to have the principals in those components talking to each other. And beginning to say, yes, I want to be part of this, rather than the kind of territorial restrictions that and in a lot of cases, I think artificial restrictions that are built up. So I would try not to forget the fact that this is a leadership and a culture change, as well as a whole way of rethinking how we collect and review data.
Wow. 5 amens to that. That's I would just follow up that that thought with saying, I don't think there's a shortage of ideas. I don't think that's what you're looking for in terms of advice. I think what I don't see enough happening at the federal level or at the state level is how to be ruthlessly strategic about getting your ideas implemented. And that means know who your champions are, know who your champions are not, and even if this is not your motivator, hit them in the pocketbook. Really think about where the money is, because that's what generally pulls most of our strings in government. State, local, federal. I've been a bureaucrat for 20-something years. I'm telling you, it generally comes down to the budget. And there are fabulous ideas that fall to the wayside for that reason. But if you know who your champion is, and you know who your champion is not, and you lay it out like you are plotting a defensive game in the NFL, and you really think strategically, who do I need to talk to before this meeting? Who's the kind of person that doesn't like new ideas sprung up upon him or her at a staff meeting? It would have been better to go to them on the inside. I'm telling you, apply psychology to what you want to achieve, because culture change is really, really hard. And it's not for lack of really good ideas that we haven't gotten further on this. It's because you have to have people who are 100% committed to thinking about it strategically and how to get there, and not just from a technology perspective, but on how to get the buy-in for it to happen. And that generally means your champions, know your barriers, and know what the budget impact is if you do it a different way, so you have a strong case.
Will you please join me in thanking the panel?